Right, welcome once again to this virtual class where we are going to do a virtual practical of histology, focusing on the endocrine glands. Now, this is not going to be a lecture. You have already done the lectures, and my assumption is that you've gone through those 3 lectures that I shared with you earlier, because this one is not going to be a lecture of the endocrine system. It's going to be a practical. So it will be more of focusing on how to identify histological slides of endocrine glands on a microscope. For you to understand this, it requires that you already know something about those endocrine glands from a theoretical perspective. And so the lectures that you listen to on the endocrine glands, those 3 lectures capture the theoretical aspects. I'm not going to repeat them. It will just be on a practical, this one. Maybe before we start on those practicals, I just lay down some general concepts regarding the histology of glands in general. By definition, a gland is a tissue, and remember, tissue is a group of cells. It could be a tissue or an organ, that should be or. It could be a tissue or an organ that produces and releases substances that perform some specific functions in the body. So it doesn't have to be an organ, could also be just a tissue. But yes, it can also be an organ. If this tissue or organ is producing some substances that perform specific functions in the body, that tissue or organ qualify to be called a gland. There are 2 types of glands. We have exocrine glands and endocrine glands. Exocrine glands produce body fluid. So the substances we are talking about here are body fluids. And these exocrine glands produce these body fluids into epithelial surfaces. Now the fluids travel through a ductal system to reach those epithelial surfaces, which means that the exocrine glands will release the body fluid into a ductal system, and then the ductal system transport that fluid up to an epithelial surface. Those epithelial surfaces don't have to be the outside of the body like skin. They could also be just internal epithelial surfaces like respiratory tree or digestive tree. So with that understanding, we'll expect exocrine glands to have an elaborate ductal system, at least, that will be able to receive the body fluids. Examples of exocrine glands, therefore, would include things like sweat glands, mammary gland, lacrimal gland, the sebaceous glands, the salivary glands, gastric glands. You realize that they all produce body fluids, which have some specific functions. Those fluids are released into ducts. Those ducts transport those fluids into surfaces. The converse of exocrine glands are endocrine glands. Endocrine glands produce hormones. And as you heard in the lecture, a hormone is a biological chemical messenger that is released into the bloodstream so that it can act on a distant target organ. The understanding here is that hormones are produced by cells which are away from the target tissues of those hormones. So the only way that these chemical messengers can be transported, can move from the site of production to the site of action is if they're released into the bloodstream. The bloodstream here, therefore, becomes a mechanism of transporting the chemical messengers from the secretory cell, which is in the gland, to the target cell, wherever it is. Therefore, you understand that hormones will have to circulate all over the body generally. So the subject matter of this class is to focus on the endocrine glands, and you already know which kind of endocrine glands you're going to focus on, so I don't have to give you examples of them. For most glands in terms of histology, and we'll be expecting you to start your description of histological organization of glands this way for most of them. So whether they are endocrine glands or exocrine glands, most glands have two histological components. This is what we call the stroma, and this is what we call the parenchyma. The stroma refers to the connective tissue framework of a gland or an organ. The parenchyma refers to the functional component of an organ. And if that organ is a secretory organ, which means a gland, then that parenchyma refers to the secretory components of that particular gland. So understand, stroma is the connective tissue elements. Parenchyma are the cellular elements that contribute to secretion in that particular gland. So most glands, whether endocrine or exocrine, as long as it's a large organ, it's an organ, it will have those two components. And so I want you to be able to be starting your discussion at that point. If you're asked to write an essay on the histological organization of gland A, most of the time, not all the time, most of the time, your story will begin there. Gland A has two histologic components, the stroma and the parenchyma. Then say something more about that stroma. And let's say something about that stroma. Again, in terms of organization of the stromal tissue of a gland, having mentioned that the stromal tissue refers to the connective tissue framework, we expect you to know how the stromal tissue of a particular gland is organized. And what I'm going to give you in this slide are general concepts that apply to most glands. Having mentioned that the stroma consists of the connective tissue framework, you understand, therefore, that the purpose of this connective tissue framework is to provide structural support to the parenchymal elements. That's important. Providing structural support, holding the cells together, holding the whole organ in position. But these connective tissue components also are important in transmission of blood vessels, whether they are arterioles or capillaries. They run through these connective tissue elements. There'll be most likely arterioles and capillaries, but you can still have smaller arteries there as well. This supporting framework contains blood vessels within, and is a way in which the blood vessels can be on the surface and also others going through into the organ via the connective tissue elements. Also within that supporting framework, we have lymphatic channels. and different glands may have different degree, different amount of lymphatic vessels. But generally, in principle, the connective tissue elements carry lymphatic vessels as well. Now, that is as with regard to the functions of the stromal tissue. In terms of its histological organization, the stroma of a gland, and again, this applies to most glands, the stroma of a gland consists of a fibrous connective tissue capsule. So this is something that covers the whole organ. It's a fibrous connective tissue and it's covering the whole organ. For some glands, this can just be loose connective tissue. For some glands, this could be dense regular connective tissue, which means that it has collagen fibers, which are closely packed and running in a uniform direction. So you're able to follow the collagen lamellae as they run in a particular direction. You're able to see that. For some glands, it could be dense, irregular connective tissue covering that particular gland. So therefore, what is required of you is to be able to know, so which gland will have the loose type of connective tissue capsule, which gland will have the dense regular connective tissue capsule, and which gland will have the dense irregular connective tissue capsule. That becomes important. So you have to tailor that to a particular gland. And perhaps this is one of the things, therefore, you can use to be able to distinguish glands. If you know that you expect a dense regular connective tissue in a particular gland, and you see it, then fine. If you know that a particular gland doesn't have a dense regular connective tissue, yet what you have is a gland with a dense regular connective tissue, then it means it cannot be that gland. It actually becomes black and white for some glands. So anyway, the connective tissue capsule is applicable to most glands. The type of the connective tissue capsule is variable. The other thing that the stroma consists of is that this connective tissue capsule may send in some septae or trabeculae. These are projections from the capsule. These projections go into the organ itself and tend to divide the gland, the parenchyma of the gland, into some smaller parts. If those smaller parts are visible naked eye, then they are lobes. If those smaller parts are only microscopic, then you call them lobules. So lobes are larger than lobules. But the concept here is that the trabecula divide the gland into lobes or lobules, or sometimes both of them. It will just depend on, so which kind of gland are we talking about? Now remember that even though the trabecula enter through and split the gland into smaller components, those lobes and lobules may be, in most cases, incomplete, which means they're not completely separated from one another. But sometimes we may have complete lobules, although most of the time they are incomplete lobules, which means that the lobules may be still interconnected. Now, even though we have trabecula going in, this trabecula still function as supporting framework. They still transmit blood vessels and they still convey lymphatic channels. Now, based on this, again, there's some glands which are very definite trabecula. You're going to see them, they're prominent. And that becomes, again, a point of reference when you want to distinguish some glands. There are some glands, however, that have very thin or hardly any trabecular network. And so also that becomes a point of reference when you want to identify them. So you can also use that as a parameter in identifying glands. So that's generally about the organization of the stroma. Now let's talk about organization of the parenchyma. When you want to identify a gland histologically, one of the things that you need to look at is the stroma fine. But the other important thing that you need to look at is the parenchyma. And there are a number of things to check in the organization of the parenchyma. We may have talked about this in another setup again, but I'll just repeat them for the sake of this particular class. So the parenchyma of a gland may be organized in these three morphological patterns. You may just have a cluster of cells, which means cells are in groups. Or you may have cells arranged in a cord-like pattern, which means that cells just fall on top of one another. They form like strings. Or you may have a follicular morphology, which means cells form a ring around a central material. If you have this organization as how the cells of the parenchyma of a gland are organized, then that becomes an endocrine gland. The endocrine glands have their cells organized in those particular three morphological patterns. Now, this image shows you a particular pattern of organization, the first image. So let's do this practically. I want you to write in the chat. Is it follicular? Is it cluster or is it cord-like? So yes, 30 seconds. I've enabled the chat for you. And I can see your responses so far, majority getting it right. All right, I'll close the chat now. So most of you have said that is follicular morphology, and that's a correct response. Some of you have said a cluster, or one or two people said cord. That may not be true. So this is a follicular morphology. A ring of cells around a central material. The second image shows you another morphological pattern. Okay, again, just write in the chat there, which pattern is this one? The chat is enabled. Very good. Everyone who has responded has gotten it right. That one is a cluster morphology. And so you can see that the cells are just grouped together. And so the last one definitely becomes the cord morphology, where we see strings of cells forming somewhat like columns in some places. Anyway, I believe you've understood what cord morphology looked like from that image. So that's one of the features you need to check, the organization of the cells of the parenchyma. If they fall under any of those three morphological patterns, that is an endocrine gland. However, sometimes a gland may have this type of morphological patterns. It could be tubular, alveolar, or acinar morphology. If a gland has any of those three morphological patterns, that is an exocrine gland. And just for illustration purposes, a tubular exocrine gland looks like this in a longitudinal profile. If this is cut in cross-section, as most histological slides would do, then a tubular gland will look like that. And what you note is usually just multiple of them, perhaps, not just a single one, but multiple of them looking like this. So those are tubular glands. The acinar morphology looks like this, the second image. So in acinar morphology, the secretory portion of the gland has cells in form of prisms like this, and very long. And that makes the lumen of the secretory portion to be very narrow. But still, the secretory portion is ballooned out. If you compare that to tubular morphology, the secretory portion is not ballooned out, just same size as the ductal portion. You know, an exocrine gland has two functional portions, the secretory portion and the ductal portion. Those are the two functional components of the parenchyma of an exocrine gland, the ductal and the secretory part. So for tubular morphology, the ductal and the secretory part, just there's no major morphological difference because the secretory portion is not ballooning out. For the acinar morphology, yes, the secretory portion balloons out, but the cells are very long and prism-like. And so the lumen of the secretory portion is still tiny. Sometimes that lumen is not even visible. It's obliterated. So this is acinar morphology. That's how it look like on cross-section. And importantly, how you pick the acinar cells is that the nuclei of the acinar cells are still usually basal, as you can see in that particular illustration. So the rest of the cytoplasm is what you see towards the lumen, which may be obliterated sometimes. For the alveolar morphology, this is the last morphological pattern. So the secretory portion is ballooned out, but the cells are not prism-like. So they're still, most of the time, simple cuboidal epithelium. And so the cavity of the secretory portion is expanded as well. And that is what we call alveolar morphology. This is how it looks like on cross-section. So if you see tubular, alveolar, or acinar morphology, you conclude that is an exocrine gland, not endocrine, but exocrine. The other thing that you are required to check, and this one is important when you've determined that the parenchyma is consistent with the exocrine gland. If the parenchyma of that gland is consistent with exocrine gland, and especially for the acinar morphology, it is important that you check how those secretory cells, the cells in the secretory portion, are staining. So there are those which contain mucus as their secretion, which means that the body fluid being released contain high content of mucus. And so because they are mucus cells, they don't usually pick the natural, the common histological stains, histological dyes, which are water soluble. And so they'll just appear as white. And we describe that as being mucus acinus. But you may also have situations where those cells pick up the stains. They pick up the stain because the secretion those cells contain are hydrophilic. And so the dyes pick them. Then we term them as being serous glands. So the image I'm showing you here shows you an exocrine gland with acini. So I want you to write down which type of secretory cells would this be? How do you classify this one? The chart is open. All right, good. I'll close it. Most of you have failed it, though. There are a few sick people in the group as well. It's okay. You can go to the clinic for some review. I've seen some people writing adipose as the type. That one I call sickness. I've seen another crazy response that's run away, but fine. So most of you have said mucus, and I know why you've said mucus, but this is not mucus. Now, you see, these ones are mucus acini, yes, but these ones are serous acini. So this one is a mixed type. And a few people have gotten it right. You call it seromucus. So these are seromucus. These are seromucus type. So there are some exocrine glands which are seromucus. They produce both mucus as well as serous secretions. Okay, the second image. I want you to try that again. So I've enabled the chart for you. Classify that one. Okay, great. I've closed it. Again, this one, most of you have failed it. This one is still seromucus, just like the previous one. Why do we say so? We see these are these are mucus acini. And then these are serous acini. So this is still seromucus. Now, let me say something about seromucus pattern. In a seromucus pattern, you have a mixture of both. That does not mean it has to be 50-50. It may still be 40-60. And that will still apply. So maybe in the first one, it's a 40-60, perhaps with the mucus one being dominant, but it's still mixed. This other one, maybe a 40-60 or perhaps a 30-70 with the serous one taking the lion's share, but it's still seromucus. So a classical serous pattern is the one shown on the third image there. Most of these ones are staining, most of them. So you're only seeing a small part that's not staining there, less than 10%. So this is definitely predominantly serous. This is predominantly serous. You may notice something else there. So what you notice there, I want you to identify it, this structure here. Again, just put it on the chart, I'll see. What is this structure called? All right, good. I've closed it. A good number have gotten it, but still a good number are lost. Now, this one is a duct. Remember, we are looking at an exocrine gland, which is a serous gland. So that means that this gland is expected to have a ductal portion. So this structure here is a duct. Look at the epithelial type that line the duct. Okay, we can take a simple columnar or a stratified cuboidal there with a lumen there. So that's a duct. That's not a secretory portion. You can't have just a single isolated secretory portion like that one. Then you want to call it a secretory portion. I'm saying that because I've seen someone writing alveolar morphology. Well, a few sick people have still written assigner morphology. I think you got lost from somewhere. I hope you'll recover yourself. It cannot be a capillary, as some people have written. Remember, capillaries are lined by simple squamous epithelium. They're not lined by simple cuboidal epithelium. So it's a segment of a duct. We are not looking at types of ducts today. We'll look at them another time. So let's keep it to a duct. So these are serous gland, and evidenced by the staining characteristics of the acini. So we confirm it's an exocrine gland. And the other evidence to make us know that it's an exocrine gland is the presence of ducts. And so the presence of ducts is also another feature in the parenchyma of glands that will help you know that you're looking at an exocrine gland as opposed to endocrine gland. Lastly, in the last image, we see acini which are predominantly mucus. So that the only things which are staining in this particular slide are actually only those ones. Yes, they are serous, but those ones are not acini, as you can see. They are ductal portions as well. So the secretory portion of this gland is predominantly mucus. We see hardly any serous acini here. These 3 or 4 that we are seeing are ductal portions. Again, confirming that that is an exocrine gland, and in particular, a mucus exocrine gland. Right, so I hope you've captured the characteristics of the parenchyma of an exocrine gland. I've already told you that the presence of ducts is one of the features that you are expected to talk about if you see, and it will help you know that what you're looking at is an exocrine gland. For the type of secretory cells, we've already agreed that yes, you can have a mucus pattern, serous pattern, or a seromucus pattern. Once you've talked about those standard things, it is also important to look at some other unique features of the parenchyma of a particular gland that you're talking about. Now, this may not be easy to generalize because there'll be some unique features about perhaps each endocrine gland that stand out. So they become parameters that you also use to help you identify a particular gland. But we cannot use that parameter as a general standard for what you check when you want to distinguish exocrine glands. For example, if the parenchyma of that particular gland contains some particular secretions and they're usually stored in a particular form, you may be able to see that one on some glands. And we are going to see some examples. So here I'm saying you pick any other unique feature of the parenchyma. If the parenchyma is lobulated, talk about it. If that's a unique feature, it may not apply to all, but maybe some may have that kind of lobulation. Talk about it. Then you also need to highlight on the unique organization of the stromal tissue. I've already taken you through organization of the stromal tissue. So I'm telling you the things you check on light microscopy to help you identify a gland. You look at the organization of the stromal tissue. Does it have a capsule? If it has, is it a thick one or a thin one? Which kind of connective tissue capsule is it? Is it loose? Is it dense regular? Is it dense irregular? Does the capsule send intrabecular? And if they are they thick or thin? So that unique organization of the stromal tissue, you highlight it, and that will help you know the organization, will help you identify a particular endocrine gland. And lastly, you may also want to check anything else that is surrounding that particular slide that you've been given. For example, if the gland you're given is the gland of the breast, it's not an endocrine gland, but I'm using it. The breast is a skin appendage, which means that you'll be able to see skin adjacent to that particular gland. And so that will help you identify it. Let me give another example. If I give you a slide of the parathyroid gland, you'll be able to see thyroid gland next to the parathyroid gland. So that's what I'm talking about. If I give you thyroid gland, in some slides, you may be able to see trachea next to it. So you pick anything else surrounding that guide you in the identification. So having said those many things that you talked about, I want to now look at specific slides with the hope that you are going to identify them and describe them. Or let me put it this way, you are going to describe them histologically and then identify them. But this is my expectation of you. One, for you to go through this session in a productive manner. I am assuming you've actually watched the 3 lecture recordings on organization of the endocrine system that I shared with you previously. Because if you've not done that, then this is going to be a lot of noise for you. So I'm assuming you've done that. That is what I expect of you. The other thing I expect of you is that I'm going to show you some slides. I have about 8 or 9 of them. For those slides, I want you to provide a histological description of the slides. The priority at this point is not in the identification. The priority at this point is on the description. How would you describe how this gland is organized, the slide given to you? And I'm hoping that you are going to remember the parameters that I've given you in the previous slides to use as a guide on your description. Now, when you are describing histological slides for the purpose of identification, it is good practice to start with the obvious features. So you don't have to describe them in the order in which I gave you the features to look at. No, I don't want you to restrict yourself on that one. But I want you to start with the big picture. When you're given a slide, what is shouting at you? What is looking at you? Don't look for the type of granules that the cells contain. And you are forgetting to see that there are big lobes, for example. So start with those things which your eyes pick, even from a distance, and then narrow down to the specifics. And if you can, try as much as possible also to highlight on the stroma and the parenchyma. In that context, it's been very nice. So that's how I expect you to provide the descriptions on the slides I'm going to give you. After you've given that description, then our next agenda is to provide an identity to identify that particular slide. And that will be based on the description. And finally, I expect you to be able to recall from the lecture something unique about that particular gland that I'll have displayed to you. Maybe the function, the parenchymal cell types, the hormones or the secretions that these particular cells release, and perhaps the functions of those secretions. You expect you to recall how that gland is regulated to perform its functions, and some of the disorders related to the function of that gland. I will not talk about number 4 because it's already captured in the theory lecture, but I expect to recall that one. So with that in mind, I'm giving you the first slide being projected there. So in this slide, I'm calling slide 1. There are 3 levels of magnification I'm going to give you. I'm calling them plates for the sake of this particular lecture. So let's understand, when I talk of plates, I just mean the number of slides in that particular one slide. It's the same structure, but now different magnification levels. I've just called them plates. So the lowest magnification is this one. I'm giving you 30 seconds to look at it. If you're able to scribble something on your end, not on the chat, just on your end, just pinpoint some things. I'm hoping you have a book and a pen and you're seated on a table, you're not on a matatu going somewhere. So you're able to write down some things so that we have a checklist. Then you're able to evaluate yourself on how you're doing between 0 to 10. You can grade yourself. Right, I'm hoping you've looked at that slide, at that magnification, and so you have some things you've noted down, which are features you're seeing at that lower magnification. I'm hoping you've captured some 3-4 things. I'm giving you a second level of magnification. So in this second level of magnification, I just want you to add to the first list of things you've written down. Just capture what is new, so that you don't have to repeat what you've written. But if something comes into better view, you can highlight that, or what is new, you can highlight that. All right, before I give you the third level of magnification, I want to hear some of the things you've written down. So this one I'll allow you to speak. So any volunteer? All right, I see I did carry on.
There's a presence of mucus and steroid.
Okay, good. Anything else? Just, I expect you to just tell me elaborately what you've written down in like completely everything written down concerning that one. Okay, let me give it to John.
Yeah, good morning, sir.
Morning, John. How are you?
I'm very fine, thank you.
All right.
So I've written down a few things here, sir. The first one was that when you gave us the other magnification, I was able to tell that the stroma was dividing the slide into lobes because I was able to see. And then when you now gave us this one, so I can see that the stroma is running and dividing the slide into lobes. And then when you gave us the other magnification, the one that you just removed, I was able to see lobules.
Okay.
Yeah, so the stroma is now going into the gland and dividing the gland into lobules. I mean, dividing the lobes into lobules. Okay, and then what my colleague just said is that the gland is seromucous.
Very good. Very good.
We can see some that are not taking stains, and they are acinar. So those are the mucus secreting ones, and we can also see those that are taking up stains. So and then there is one I'm able to see a very big duct. So those are some of the things that I've seen, sir.
All right, thank you, John. You've done really well.
Thank you, sir.
So John has captured almost everything that I expected you people to capture. So let me just regurgitate that for you. At this low magnification, what is standing out is lobulations. We can see an organ that is lobulated. So there's a lobule there, there's a lobule there, there's a lobule there. So these are lobulations. The other thing that is standing out here are ductal systems, very large ducts, like that one. So there are large ductal systems. And these ductal systems, as you can see, they are within a core of a stromal tissue. So there are ducts outside the lobules. We call those ducts extralobular ducts. There are ducts outside the lobules. However, we can also see ducts inside the lobules, those tiny ones. But we are not able to confirm at this magnification if that is actually true. However, this one perhaps is more confirmatory, or that one. So other than extralobular ducts, we also see ducts within the lobules. We call them intralobular ducts. So yes, there's lobulation because of how the stroma is dividing the parenchyma into lobules. With the trabecula, you can see those trabeculae or septae, and yes, extralobular ducts, and yes, intralobular ducts. In this magnification, I also see blood vessels. You know, these are blood vessels. Then going to a higher magnification, now I'll just add, I confirm that yes, we have intralobular ducts, because this is one big lobule. But again, in the lobule, we see organization into acinar morphology with the mixed acini. So we have serous acini, the ones that take up stains, and mucus acini, the ones that do not take up stains. So we confirm that the parenchyma is seromucus or mixed type. And I'm happy that the people who have spoken have picked that this is therefore not an endocrine gland, but an exocrine gland based on the things you've seen. This is a third level of magnification where we see a unique type of organization, the mucus acinus surrounded by some serous cells, which look like the crescent moon. We call that arrangement demillion. And because they are formed by serous cells, we call that serous demillion. We see serous demillions in the submandibular salivary gland. And so that slide is the slide of a submandibular salivary gland. Now, remember what I told you? There's some things which are unique to a particular parenchyma of a gland. If you see, you talk about it, it becomes very characteristic, or the term we use is pathognomonic. It means very characteristic for that particular event or structure. Good, that was first slide. Let's try slide number 2. So this slide number 2 has 4 magnifications. I'm calling them 4 plates. I'm giving you 30 seconds to look at that particular magnification and just jot down something, the features you see at this level of magnification. Just write down at your end. Pick out some 2, 3, 4 things that stand out for you at this magnification. Then I'm going to give you a second level of magnification. Then you write down something as well. And then the third one and the fourth one lastly. You don't have to write long sentences. Remember, you are the one going to use this as a reference. Just mark yourself. So you just write down what stand out, 1 or 2 words for each point. Right, I believe you've done that for that level of magnification. Now that is second level of magnification. Add to your list what is new or confirm the previous one. Another 30 seconds for that one. Right, let me give you a third level of magnification. That is the third level of magnification. Just put down what is new. And finally, that is the fourth level and the last level of magnification. Just write down what's new. All right, good. So let me hear from 1 or 2 people. I think it's better to go step by step. So I'll go back to the lowest magnification for you. So any volunteer to describe this one? We can walk through the 4 levels of magnification one by one. So just put up your hand and I'll enable your mic. We describe together. We'll just be reading what you've written down for each magnification, and I'll guide you. All right, Juma.
Good morning.
Morning, Juma. How are you?
I'm fine.
Yes, carry on.
So in this first slide, I saw it's encapsulated.
Okay.
Then it's lobulated.
Very good.
Then it has the ductal system.
Okay.
Yeah, that's what I saw.
Okay, good. So let me take you to second level magnification. What is new?
Okay.
Carry on.
So I saw are they the follicular cells or something like that?
Okay, you are the one talking, remember?
Yeah, in this second slide, I didn't see clearly.
Okay, okay. I can take you to third magnification. What is new? So Juma, carry on.
I can see the granule cells.
Okay,
Then there's a portion where it has not taken the stain.
very good. What do you call that portion that has not taken the stain? How would you describe it?
Mucus.
Okay, all right, good. All right, let me have another person before I give you a ruling. Any other person who also wants to try? We can start from first modification, second, and the third. I think the third and the fourth are almost the same. Yes, Haji.
Yes, good morning.
Morning, Haji.
The first slide, I can see presence of lobes
Okay.
and also presence of ducts.
Mhm.
Well, that's what I can say in the first slide.
Okay, so lobulations and ducts. Good. Second slide, second magnification.
The second magnification, I think I can see serous acina.
Okay.
Yeah.
All right.
That's,
So, okay. So second magnification, serous acini.
yes.
I go to third magnification.
Yeah.
Okay, that one.
On the third magnification, I think I can see weight of Langerhans, maybe. Not sure.
Okay, I don't think that's a description. What you said last, that one, that Langerhans is not a description. What is it that is histologically descriptive, what you're saying?
Maybe now the serous acini can be seen clearly, much clearly over there.
Okay, is that what you call Langerhans? Okay.
Sure.
All right. Okay. Okay. Let me give you a ruling on it then. So let's start with the first one. So the things I want you to pick, or hoping you've picked, and the first speaker did pick that, is that the organ we're looking at is encapsulated. So the stroma, it is encapsulated, although the capsule is not a very thick connective tissue. It's very thin. It's actually surrounded by loose connective tissue. You can see that one. Thin, loose connective tissue surrounding the organ. And that this loose connective tissue send in septae or trabecula, which seem to divide the organ into lobules. And both speakers have picked that the organ is divided into lobules. The other thing I want you to pick, and the two speakers have done that very well, is that we can see presence of ducts. There are several ductal systems. And remember, when you see ducts, it tells you that you're looking at an exocrine gland. So they're ducts. Perhaps that's the best we can do with confidence at that magnification. Then going to second level of magnification, So we'll just put additions. We see blood vessels like those ones. Those are blood vessels. They're not ducts because they're not lined by simple columnar or simple cuboid. So they're not ducts, they're blood vessels. And essentially, when you see them running in pairs like that, most likely one is an artery and another one a vein, if it's not a point of bifurcation. We confirm that the lobulations are there. And so we're looking at just one big lobule or maybe two small ones. Looking into the lobule, well, I'm not repeating the issues of loose connective tissue, trabecular. We confirm that one. Looking into the lobule, we see that the lobule has two major components in the parenchyma. We have this region here, which is serous acini. These are serous acini, but perhaps a higher magnification will confirm that one. But we can see it's serous. Now, what I don't agree with both speakers is how they have described these other things here. These are not mucus acini. Remember, acini will have nuclei in the periphery and a lumen that may be obliterated. These ones are not mucus acini. These are clusters of light staining cells. Look at them. The cells are numerous, grouped together. So the parenchyma has clusters of light staining cells. That stands out for this particular organ. And so a higher magnification confirms that we have a cluster of light staining cells. You can describe the class as being ovoid or spherical. And that we also have serous acini. These are the serous acini. Look at that. These are acini. You hardly see the lumen, but you can see cells in the periphery. The highest magnification I've given you confirm one last thing, that this light staining cluster of cells is heavily vascularized. You can see these are blood vessels running into it. Okay, this is also a blood vessel. These are acini. Now, let's say something about the acini first. So the acini contain serous cells. So they are serous acini. And you can see cells around in the periphery of the acini, the nuclei in the periphery of the acini. So we call those ones the acini cells, basically. But there are some acini which have a cell at the center. We call that centroacini cell. And then on the cluster of light staining cells, well, with this stain, we can't be able to distinguish the different cells. So you can only conclude that you have a cluster of light staining cells. Remember, when you talk of cluster, it means endocrine. And when you talk of acini, it means exocrine. So this organ has both endocrine and exocrine components. And with the description we've given, only one organ will qualify. This is the pancreas. And so these are pancreatic acini, the one that produce pancreatic juice. We have the acini cells and centroacini cells in that particular element. And remember, the juice is produced into the pancreatic ductal system, and we appreciate the ductal systems on the lower magnification. Then this is the cluster of hormone-producing cells. That is what we call the islets of Langerhans. Remember the cell types of the islets: alpha cells, beta cells, delta cells, PP cells. And remember their secretions as well. Remember the functions of the hormones there. So we agreed that is a theory component. We are not addressing that in this particular session. Slide number 3. 3 magnifications. The first magnification is that one. Take your 30 seconds, look at it. Write something down which stand out. Okay, now that you've captured how we are doing it, I will want us to increase our speed so that we finish in time. Right, second level magnification. Just put down what is new. Third level magnification. You can capture what's new. Right, I believe you're good now. So I'll take it to the lower magnification again and give you opportunity to describe. So any volunteer for this? I can see John. Okay, John, let me give it to Queen. At least you'd answered the other one. Let me give it to Queen.
Morning, sir.
Morning, Queen. How are you?
I'm good. At the first slide,
Mhm.
I can see it is encapsulated. The stroma, so it is encapsulated.
Mhm.
And then I can also see small follicles of varying sizes.
Mhm.
Mm.
Okay, very
Then
good.
the
Second magnification.
The second magnification, if you look if you look at the follicles, they have the follicular morphology. The cells have ring surrounding it, and then at the center we have an homogeneous material.
Very good.
Yes.
All right. Last magnification. Anything new?
Nothing.
Okay, good, good, good. All right, you've done very well. Let me give it to Mercy. Mercy, you can also try, give us your thoughts.
For the first, it is surrounded by a connective tissue, so it is encapsulated. So, and it contains a trabecula, which extend into the gland. I'm seeing some blood vessels.
Good.
Yes, and there are 2 types of cells here.
Okay.
There's go to the next.
Okay. Okay.
So these other cells, which are big, they are surrounded by follicular cells, and in between there is a colloid material. And then there are other type of cells which is not surrounding anything, so we call these it's a parafollicular cells.
Okay.
Yes. Then the cells are simple squamous, the one surrounding the the one with colloid material. The cells are simple squamous.
Okay, good. Right. I believe that one you are able to pick from the third magnification which I've given you. Anything else new? Mercy, we are good?
Yes.
Okay, thank you, Mercy. Right, so Mercy and Quinn have described this well. And through that, we are able to capture some features. I like the way they have synergized one another to help us pick the features that you're supposed to pick. So yes, so at that magnification, we appreciate that this organ is surrounded by a connective tissue capsule. It looks interrupted in some regions, but it's there. We also see that this capsule has some trabecula that extend into the organ itself, and we can see that one. The trabecula that extend into the organ are not very thick. It's not dense. It's actually a loose connective tissue. I like what Mercy picked, that at this magnification, there are several blood vessels as well, and we can see them. So this organ is richly vascularized. And what both of them picked is that at this magnification, we can appreciate that we can see follicles, because we can see follicular morphology. Follicles of varying sizes. These follicles are either spherical or ovoid, and that is ovoid, and perhaps that one is spherical, of varying sizes. We can be able to pick that from at that magnification. Then going to second level magnification, we confirm what you've seen in the previous slide. And we are confirming that the follicles consist of a ring of cells. We are not able to determine the shape at this magnification, but that ring of cells surround a central homogeneous material. Homogeneous here means uniform material. The other things you've already captured, so let me not repeat them. Then at this last magnification, some two additions I want you to pick. We are able to confirm the shape of the cells which surround the homogeneous material, and Mercy has correctly picked that. Most of them are actually simple squamous here. I agree with you, Mercy, on that one. Most of them are simple squamous, like in that zone, although some of them are cuboidal, like this one. So the homogeneous materials are surrounded by either simple squamous or simple cuboidal epithelium. The other thing I want you to pick is that there are some cells which are within the loose connective tissue. So they are not surrounding the homogeneous material, these ones, or those ones, or these ones. They are within the loose connective tissue. They are not surrounded, they are not part of the follicles. The third thing I want to pick is this one. You know, that's a capsule. So this one is picked in for us a capsule. Well, we've seen it, but we confirm again that that's actually a connective tissue capsule. So with that in mind, all those characteristics allude towards what all of us know. This is the slide of the thyroid gland. And so these are thyroid follicles of varying sizes. Remember, each follicle consists of a ring of follicular cells that surround the colloid material. And between the follicles, we have the parafollicular cells, like these ones. These are parafollicular cells. You should be able to pick a parafollicular cell if you're given this slide on a microscope in a Viva exam. You should be able to pick and say, it is this one. So these are parafollicular cells. These are follicular cells. So remember from the lecture, follicular cells produce calcitonin, parafollicular cells produce T3 and T4. We expect you, if you're describing histological organization of the thyroid gland, that you talk about organization of the parenchyma of the stromal tissue, as we've stated, and organization of the parenchyma, as you've stated. We also expect you then to talk about how the follicles behave or appear depending on the functional state of this organ. So after we've talked about the organization of the thyroid parenchyma, as we've stated, it is important that you bring that aspect up. When the gland is active, the colloid material is minimal and the follicular cells are high cuboidal, or they're columnar, they are long with some cytoplasmic projections. When the gland is not active, and the one we're looking at is most likely not active, the colloid material is abundant and the cells are low cuboidal, and that is why they're actually appearing like squamous. They are low cuboidal cells. All right, that's the slide of thyroid gland. I believe the rest of the story about thyroid you've already captured from the lecture. Slide number 4. So this is the lowest magnification. This is the field of the slide, but we are focusing on this structure here. So that is that magnification. I hope you've written down what is standing out for you. And then that the second level magnification. So again, capture what is standing out for you at that magnification. Remember, we are focusing on this one. And lastly, that is the third level of magnification and the last one. Okay, I hope you've captured those three. Now let's go back to the first one. So volunteer. Okay, Harrison, I'll give it to you.
Good morning, sir.
Morning, Harrison.
Yeah, so for me, since from the previous slide, you'd say that that one was the thyroid gland. Now for this structure, I can see that it's in within the thyroid gland. So maybe that gives us, it shows us that could be the parathyroid gland. We will know that it's, I can see the encapsulation, it's encapsulated. If I'm not wrong, yeah, I guess it's, I can see the capsulation, it's encapsulated around it.
Yes.
And then it's oval in shape.
Okay, good.
So maybe let's go to the next.
All right, good. That the next one.
Yeah, right from here, I can see that it has got a mixture of cells. Some are taking stains, while others are not. Yeah, and yeah, next slide.
Okay, good. You are there?
Yeah, from here I can see the adipocytes, the white ones, the white cells, the adipocytes.
Okay.
They are visible, and maybe the clear cells are also visible together with the adipocytes.
All right, good. Fair enough. Fair enough.
That I can see.
Very good, very good. Anyone else want to add to what Harrison has said before take it up? Thank you, Harrison, for that. Yes, Mercy. Okay, Mercy, let me give it to someone else. You had answered. So there's this person who has not identified the name, but you have your registration there, 3218.
Good morning. Can you hear me?
Yes, I can hear you, 3218.
Okay, so if we could go to the first slide.
Okay, good. You're there?
Yeah, so just as has been said, the mass there is ovoid in shape, but an additional characteristic that I can see is that the cells in this structure are deeply staining. That they have absorbed the stain, so it has serous cells.
All right, very good.
And there are some portions that are not picking up stain. I'm not sure if they're cells, but I think they're blood vessels.
All right, good.
Could you go to the next slide?
One is that one.
Okay, this magnification, I can see that there's a connective tissue surrounding the structure. So I can say that it is encapsulated.
Great.
So
Final magnification.
Yes.
So that's a final magnification.
Yes, so there are the adipocytes that are not picking up the stain. And then there are other smaller cells that are not picking up the stain. From the recording, this one, you say that they were the clear cells of the parathyroid gland. And then I can confirm that the cells that are picking up the stain that are surrounding these adipocytes are in the cluster morphology.
All right, yeah. Good. Thank you. That's okay. So let me wrap it up based on those two. Okay. I can see some people want to contribute, but allow me to just give chance to only those two so that we are able to manage time as well. So from this magnification, the thing that stand out first is that you can see a cluster of deeply staining cells organized in an ovoid pattern. It's an ovoid cluster of deeply staining cells. That's one. And two, that ovoid cluster of deeply staining cells is adjacent to the thyroid gland based on what you said in the previous slide. 3 is that we can note that it is encapsulated. Although I agree with the second speaker that capsule is best seen in the second magnification and not the first one. But the fourth thing that I want to capture is that yes, there are blood vessels. So you've captured those 4 at that magnification. Then second level magnification, we confirm the encapsulation. We confirm the blood vessels. And we confirm the cluster morphology, deeply staining, next to thyroid gland. Third magnification is purposely put here to help us understand that there are different morphologies of cells. Now let's name them. So these ones, the largest are the adipocytes. The second largest with staining cytoplasm, oxyphil cells. The third largest with clear cytoplasm, clear cells. And the smallest cells with very thin, deeply staining cytoplasm, these ones, the principal cells. So 4 cell types of the parathyroid glands. You know their functions from the recordings. Okay, 5th slide. So this is the lowest magnification. Capture something. I have 4 magnification for this one, but I'll show you 3 of them to start with. So that the second level magnification, you can use the first or the second one to, I think the features of the first and the second one, you can group them together. almost the same. But anything addition to this one, you can add. The third level of magnification is that one. Okay, I've given you 3 magnifications intentionally. So this one, I would want somebody to describe in those 3 levels. And after your description, give us an identification. Tell us now, based on what I've said, I think it is this organ or this gland. Okay, I'll start with the lowest ones. I want to see new hands. Yes, Christian?
Hello, sir.
Hello,
Hello,
Christian.
sir. Can you hear me? Okay.
Yes, I can hear you very well.
All right. So in this magnification, I can say there's a layer of connective tissue around this like the slide. But then also like from far, you can see there are like levels of cells, I think, like due to the staining. Like, yeah. So there's different levels of staining.
Okay, good.
I think you can go to the next one.
All right. There you are.
Then here, I'm not sure, but I think inside, like in the middle, there are blood vessels. But I would like you to move to the next one so that I can be very sure.
All right.
Right.
There
Yeah. Yeah. So now in this one, the blood vessels are clear, I think, and then like those levels of cells are also a bit more clear. So there are 3 zones of cells. Like there's an outer zone, which has yeah, like there's an outer zone which kind of seems like for me, I think.
Okay.
And then there's like another zone which is also similar, but like in a different color. And then there's a third zone.
Okay.
And then there are also like capillaries inside.
All right. All right.
So then inside, in the medulla, there are now the veins, like the blood vessels.
All right, good. So give us your identification based on what you've narrated.
I'm not sure, but I think it's an adrenal gland.
Okay, he thinks adrenal gland. I'll give it to another person. I'll give it to Raymond. Thank you, Christian. Raymond?
Hello, sir.
Yes, Raymond, carry on. So I'll take it back to the lowest magnification. What can you capture?
From the first magnification, I can see that there's a capsule around the gland. Then it seems like the gland has 2 layers of cells. The outer cells that are closely packed. Then there are inner cells that are deeply staining and have some spaces, large spaces in between.
Okay, good.
And blood vessels are there in the inner layer where the cells are deeply staining.
All right. Anything else in addition? Maybe I give you the highest magnification. What's new on that third magnification?
In the highest magnification, the outer layer, the cells seem to be in columns.
Very good.
Yes, columns.
All right, then, good. And this zone, what morphology of the cells?
The cells are clustered.
Very good. All right, let's write it. Okay, so Raymond, what's your identification?
It's adrenal gland,
according to
me.
All right, good. Okay, so yes, this is the slide of the adrenal gland. And when you're given slide of adrenal gland like this one, it's okay to even just start with the shape of what you're seeing. Now that you're able to see the whole organ in totality, you can talk about the shape, overall shape. So I don't know how you want to call that one, but perhaps tongue-like something. Yes, the organ is encapsulated, although that capsule is better seen in the second magnification. And that the organ seems to have two zones, an outer compact zone and an inner less compact zone. That is what we're able to capture at that magnification. At the second magnification, we confirm that we see the connective tissue capsule. It looks like a thick connective tissue, actually. It's a dense connective tissue, most likely dense irregular connective tissue. The outer zone, very compact. We confirm the inner zone, less compact. Different staining as well. And in the inner zone, we see large vascular channels as well. So that's what we are picking at that magnification. In the third magnification, we confirm that the cells of the outer zone are in a cord morphology. And the cells of the inner zone are in the cluster morphology. So cord and cluster take us to endocrine gland. Confirm that the gland is still encapsulated, so that's the capsule. So yes, this is the slide of the adrenal gland. What's unique about the adrenal gland? Let's start with the adrenal medulla there. The cells of the adrenal medulla are in a cluster morphology, and there are several large vascular spaces within the adrenal medulla. Remember the cell types of the adrenal medulla, we have the chromaffin cells and the ganglion cells. And I hope you remember their functions. Remember how the adrenal medulla is controlled to produce its secretions. Two ways of controlling its secretions. Controlled by the sympathetic division of the nervous system, but also controlled by the secretions of the adrenal cortex through how blood vessels flow from the adrenal cortex to the adrenal medulla. So there is cortical control of the adrenal medulla, and there is sympathetic control of the adrenal medulla. You can check more on that concept. Let's talk about the adrenal cortex. I'll give you a fourth magnification that I didn't give you earlier intentionally. But at this third magnification, you appreciate that that's the capsule. The lower part there is the capsule. It's a dense connective tissue capsule. At this highest magnification, the fourth one, which I didn't give you, I want you to appreciate the zones of the adrenal cortex. So the adrenal cortex contain 3 ill-defined zones. They're not well-defined. The outermost zone, the one that is below the cortex, contain cells in cords, but those cords are arcing. Look at that one, rounding, arcing cords. That's the zona glomerulosa, which produces mineralocorticoids. The second zone consists of cells arranged in cords, which are in a columnar morphology. The cords take a columnar morphology. They are long cords in columns, like that one, zona fasciculata. The columns can be 1 cell thick, like this one, or 2 cell thick, like that one. And between the columns are vascular channels, these ones. So this is a column, that's another column. These are vascular channels. Some of those that traverse all the way from here to here are called the long cortical vessels, and the short ones are called short cortical vessels. So you have long and short cortical vessels. The inner zone is this one, consisting of cells which are in anastomosing cords. So we call this one zona reticularis. You will remember the secretions of each zone of the adrenal gland. All right, this is another slide for you. This one will require that you think deeper. I'll only give you that level of magnification though. I want a description on that level. Then, so just describe what you see. Then tell me what you think it is. Then I'll pick it from there. So I'm only giving you that magnification. Any volunteer, what do you see? Describe it, and what do you think? Okay, I'll give it to Abdi Rashid.
Yes, hello, sir.
Hello, Abdi Rashid.
Yes. From this magnification, I can see only two parts.
Mm-hmm.
One side looks fibrous, the left side, and then the other side looks deeply staining.
Very good. So what do you think?
I think it's somehow the slide of the pituitary gland.
All right, very good. That one is straightforward. So let me pick it from there. Thank you, Abdi Rashid. So this slide shows us a slide where one side is lightly staining, more fibrous to your left, and the other side is deeply staining to your right. Less fibrous. So the organ has two parts. And that is consistent with pituitary gland. However, there are some features of the pituitary gland which are not captured in this slide that you are likely to see in another slide. So maybe another day I'll show you another one and you'll see another thing. You may be able to see a cleft. Remember from the organization, the anterior pituitary gland and the posterior pituitary gland. The posterior pituitary gland is neurohypophysis, more fibrous. So that is the neurohypophysis. This is the anterior side, that's the posterior side. So this and this is the sella tussica. These are the neurohypophysis, deeply staining. So you talked much about pituitary gland theoretically. So for identification, we rely on you being able to pick the two sides, the two parts. In some slides, you may be able to see a cleft. If you see that cleft, you talk about it. Then in some slides, you may be able to see a rim of deeply staining cells on the side of the fibrous portion. When you see that, you talk about it. That's the pars intermedia. It's not in these ones. So which histological features do we expect you to pick for the pituitary? The one I'm showing you right now is for the neurohypophysis. Predominantly fibrous. We see blood vessels, we see fibers, and we see cells. That is what we pick on the neurohypophysis. Maybe this one shows us still with a different stain, still neurohypophysis. I want you to pick some three things on this part. One, it is richly vascularized. Two, it contains some cells. Now the cells it contains, the ones we're seeing their cell bodies, don't be tempted to call them cell bodies of neurons, because remember, if this is neurohypophysis, then those cell bodies of neurons cannot be, so those nuclei cannot be the nuclei of neuronal cell bodies. Remember, the cell bodies of the neurons in neurohypophysis are located in the hypothalamus. They are not in the pituitary. So these are cell bodies of the supporting cells. We call them pituicytes. So that's the second thing I want to pick, that you can see pituicytes, the nuclei of pituicytes, which are the supporting cells. The third thing I want to pick are this thing which look like that, or like that, or like that. So they look ovoid, homogeneous. These ones are called herring bodies. The herring bodies are the storage form for the secretions of the neurohypophysis. So these are storage forms. Those are at the end of the axons of the neurons which come from the hypothalamus to enter the pituitary. Their axons contain those secretions which are awaiting release. Herring bodies. So capture those three for neurohypophysis. Remember, it is predominantly fibrous. Then for adenohypophysis, the cells of the adenohypophysis are either in cluster or in cords. So you may see any of them, cluster or cord-like morphology, confirming to you that it is still an endocrine gland. There are three cell types of the adenohypophysis. That one, the one that don't take up stain, chromophobes. So that's a chromophobe. Then the ones which take that pinkish stain, those are acidophils. Remember, acidophils produce growth hormone and prolactin. So the types of acidophils are the somatotrophs and the lactotrophs. And then this one is a basophil, or even that one is a basophil. The basophils produce TSH, ACTH, LH, and FSH. So in terms of types of basophils, we have the thyrotrophs, corticotrophs, and gonadotrophs. Apart from those parenchymal cell types, we also have supporting cells of the anterior pituitary. The supporting cells of the anterior pituitary are termed the folliculostellate cells. They'll tend to be in the connective tissue framework, like those ones, folliculostellate cells, or these ones, folliculostellate cells. They're the supporting cells of the anterior pituitary. Remember, supporting cells of the posterior pituitary are pituicytes. Supporting cells of the anterior pituitary are folliculostellate cells. Lastly, the other thing I want to capture is that just like neurohypophysis, even adenohypophysis is heavily vascularized, and those are blood vessels you're seeing. Right? This is the next slide. So I'll take this. I have 2 slides to go. I'll take them up myself. I'll describe them for you. I hope you've learned how to describe. So in this magnification, we are looking at the slide of the testis. In this magnification, we note that the organ is encapsulated. And look at that capsule, very thick, dense, regular connective tissue. We call that one the tunica albuginea. So it's encapsulated, a very thick, dense, regular connective tissue capsule. Well, we see trabecula going in, but the trabecula is actually very thin, loose connective tissue going in. So it's not thick trabecula going in, but the covering is very thick. Within the parenchyma, we see several tubular structures cut in cross-section. I think that's the best I'm able to pick from this magnification. Several tubular structures cut in cross-section. Each tubule contains several layers of cells. Second magnification, I confirm that those tubular structures are lined by complex stratified epithelium. I hope you remember what that means, complex stratified epithelium. I'm also confirming that the capsule is dense regular connective tissue. Here, I'm confirming that the capsule also contains some blood vessels running. Remember, we mentioned that the connective tissue elements carry blood vessels. I'm confirming at this magnification that between the tubules, we have loose connective tissue. But the last one will do it better. So in this last magnification, we see the tubules with complex stratified epithelium. The lumen of the tubule has some elongated, some projections with spindle-shaped cells. So those are definitely the sperms at the center of the seminiferous tubules. Between the tubules, we have a loose connective tissue, which we call the testicular interstitium, or the testicular interstitial tissue. And that this testicular interstitial tissue contains some cells. Remember, we call them the interstitial cells of Leydig. These interstitial cells of Leydig are the ones that produce the androgens. Commonly, we require you to know about the ultrastructural features of the cells of Leydig. Remember, they are steroid-producing cells. They produce steroid hormones. Because they produce steroid hormones, we then expect them to have features of steroid synthesizing and secreting cell. So I hope you remember those features of a cell producing or rather synthesizing and secreting steroids. So they have them. If you've forgotten, you can revisit that. But those are the ultrastructural features. Remember, on the seminiferous tubules, we have several cells. We have cells of spermatogenic series, like spermatogonia, primary spermatocyte, secondary spermatocyte, spermatid, and spermatozoa. Those 5 are the cells of spermatogenic series. Apart from that, we also have the myoid cells. Myoid cells are contractile cells. They are found largely on the basal side, like this one. Those are myoid cells. They are flattened out on the basal side of the tubule. And lastly, we have the Sertoli cells. Sertoli cells are the supporting cells of the seminiferous tubules. Now, Sertoli cells also have some endocrine functions. What are the endocrine functions of Sertoli cells? One, they produce the anti-Mullerian hormone, or let me put it this way, they produce Mullerian inhibiting factor. Mullerian inhibiting factor is produced by the Sertoli cells of the fetal testis to inhibit the proliferation or development of what you call the Mullerian duct. The Mullerian duct is what leads to the formation of the female reproductive tract. So if the baby is male, you don't need development of the uterus. But we have a structure in the embryo that is supposed to form the uterus. So what do you do to that structure? Suppress its development. So Mullerian inhibiting factor is produced by Sertoli cells to inhibit the development of the Mullerian duct. The other endocrine function of the Sertoli cells is production of inhibin. Inhibin is a hormone that inhibits the hypothalamo-hypophyseal gonadal axis. So that one is basically a negative feedback mechanism to the axis. The third hormonal function may be not really hormone, but still an endocrine role, is that Sertoli cells produce what we call androgen binding proteins. These androgen binding proteins bind androgens in the testes to help in concentrating the androgens within the testes, which is where they're needed. One of the places where you need androgens, the testes. So it's an aim, it's the aim of that is to just concentrate androgens within the testes for spermatogenesis. So remember those endocrine functions of the testes. Remember, interstitial cells of Leydig produce androgens, and in the lecture, you know which ones are testicular androgens. The last one is a slide of the ovary. I have 4 magnifications here as well. So the ovary looks like this. You can have a word about that shape. Organized into 2 zones from this magnification, the outer zone containing follicles of varying sizes, and the inner zone containing the connective tissue stroma. That inner zone is what we call the ovarian medulla, and the outer zone is what we call the ovarian cortex. At this second magnification, we confirm that the ovarian cortex contains ovarian follicles at different stages of maturation. The ovarian medulla contains connective tissue and blood vessels. But we also see another third structure, the ovarian capsule. I'll give you a higher magnification of the capsule to understand how the ovarian capsule is organized. The ovarian capsule consists of 2 structures. Look at that one. A layer of simple squamous, simple cuboidal epithelium, an external layer. We call that one the germinal epithelium. A layer of simple squamous, simple cuboidal epithelium. And then deep to that, we have a thick connective tissue capsule, which we call the tunica albuginea. So the tunica albuginea and the germinal epithelium both constitute the ovarian capsule. Then in the ovarian cortex, that's where you have the follicles of varying sizes. The intention of this class not to teach you all the types of the follicles, but remember there are many. You have primordial follicles, primary follicles. The primary ones are 2 types, unilaminar and multilaminar. Then you have anthrofollicles, again, varying sizes. And the one I'm showing you is actually an anthrofollicle or secondary follicle. I want to use this one to name some parts. Remember, this is the oocyte, that's the zona pellucida. This is the corona radiator, and that's cumulus U for us. That's the follicular antrum. This is the stratum granulosum. External to that is the theca folliculi, with the inner side being the theca interna and the outer fibrous part is the theca externa. When ovulation takes place, this is what is ovulated, and so stratum granulosum and the theca folliculi remain. These are the ones that constitute the endocrine ovary. The stratum granulosa cells, stratum granulosum contain the granulosa cells. The theca folliculi contain the theca interna cells. Those ones produce hormones. Now, this is what happened. The granulosa cells actually produce androgens, the male sex hormones. Then the theca cells produce the enzyme that converts the male sex hormones to female sex hormones, the aromatase enzyme. So theca cells produce aromatase enzyme that converts androgens to estrogens and progesterone. So they work in collabo. After ovulation, the granulosa cells become the granulosa lutein cells, and the theca cells become the theca lutein cells. All right, now we will stop there. We've done very well. Thank you very much. Maybe I'll give you a chance to ask questions if you do have